what I can say, like right now, thinking about public health, it has become an avenue for me to make the change that I think needs to be seen in the world. Um, like when growing up, a lot of us in public health want to say we want to help people, and a lot of the ways that we know how to do that in traditional society is being a doctor, being a nurse, and I think public health has been undervalued for so long. And it is like if public health works well, it works for the most vulnerable communities, the most marginalized communities, to ensure that they not only have their health, but they have all their other needs met and that they're able to live out their best life, you know.
This is the Public Health Millennial Career Stories podcast, where you'll hear about diverse career stories, career strategies, get tips, and learn from others to help you in your public health career journey. If you want to learn about public health careers, or just hear public health stories, stay tuned because you won't want to miss this.
Welcome to the Public Health Millennial Career Stories podcast, episode number 100. Wow, everyone, can you imagine that it's already episode 100? Thank you so much. Be sure to follow me on Instagram at the PH Millennial. Be sure to subscribe to this podcast if you have not already. Be sure to leave a review. There's been 100 episodes. I'm sure that you took value from at least one of those stories, and you will take value from this story and other stories going forward. So be sure to leave a 5-star review so that I can know that I'm doing well or what I can improve on. But definitely leave that 5-star review. I greatly appreciate it. And could not do it without all the support and the listens and downloads that I do get. So I greatly appreciate all of you all for tuning in week in and week out to listen to the different people I get to interview. And I'm grateful for all the people that I do get to interview, for them giving me time and space to interview them and put them up on my platform. And I wanted to give thanks to all the people throughout my journey as well. So give thanks to Jeff Fellow, who's CEO of WellFlorida, Lindsay Redding, who was my preceptor throughout my MPH program, as well as Sarah Catalanato, who gave me an internship opportunity, and opportunities that really helped me throughout my MPH. To also shout out Dr. Prince, who was the MPH program director during my time at the University of Florida. Also give thanks to Elizabeth Ripley and Melissa Kembling at the Matu Health Foundation for giving me the opportunity. And big shout out to the entire team at the Reynolds Charitable Trust. I greatly appreciate working with you all, and it's been fun learning and doing all this work, as well as the support that I get for this podcast is also great. So thank you all. Thank you so much. I greatly appreciate it. And before I move on there, the Cape Reynolds Charitable Trust is in its 75th year, so there are going to be more celebrations around that. So be sure to follow us on social media, whether that's LinkedIn or getting in our email list to really get updates on that. So you can probably come out to the events around North Carolina, get to meet me, get to meet the team, and see the great work that has been happening around the state. Okay, well, thank you all for listening to all of these episodes and just hearing me ramble and hearing me improve. And I hope that I have improved. And but I greatly appreciate you all just like sticking around, listening to episodes again and again. Today's host is going to be Marissa McKool. So be sure to check out her podcast. She has a newly launched, or I should say relaunched podcast called Redefining Rest Podcast for Public Health Professionals. And it can be a more timely time to have this podcast. And I think it's one that is going to bring a lot of people value, especially with all the burnout and all the different stresses that have come with being a public health professional, especially during this pandemic. So be sure to listen to that. Be sure to subscribe to that podcast as well as this one, as well as Marissa is going to be having a giveaway. So there's an amazing opportunity to win a $150 local spa gift card, as well as a couple books on burnout and rest. And also there's going to be a health equity sweatshirt, health equity matters sweatshirt from the Public Health Millennial. So be sure to enter that challenge. The information is below. And if you want to support in any other way besides listening to this podcast and share it with a friend, you can go and follow the Discord channel, or just join the Discord server, which is thephmillennial.com/join. And you can find a community of public health people. They're talking about not only professional things, but ways that we can disconnect and really reconnect outside of work and outside of public health. So I think that is also important. And if you'd like to support, you can go to thephmillennial.com/support and support there. But once again, and I can't even over express how happy I am to have reached this point. And I'm just glad that you all have pushed me to continue to better myself and to continue to tell these stories. So I greatly appreciate you all. Thank you so much. And I hope you enjoy the episode.
Today, we have a motivated and inspiring public health professional pushing the bounds of public health on social media while also working towards systemic change in the name of equity and health improvement. He is the creator, as you all know, of the Public Health Millennial. He is the person helping you navigate your public health career journey. He got his Bachelor's of Science in Biology from the University of Tampa, and then went on to get his Master's of Public Health at the University of Florida. After graduating, he moved to Alaska as a community health fellow for the Matsu Health Foundation. And that is where he started the Public Health Millennial. He currently works as a health improvement program officer for the Kate B. Reynolds Charitable Trust. Welcome, everyone, Omari Richins. Woo, cheers! Yeah.
Thank you. What an awesome introduction. I'm so glad to be on my show. It only took 100 episodes.
I mean, that's the best way to celebrate 100 episodes.
Exactly.
Why don't you let us know? Like, the tables are turned. I think folks want to know, how are you? Are you coping during these times? What's going on?
I'm doing well right now. I cannot say that was the same starting the pandemic off. It was a very dreary time for myself. Being in Alaska, not really knowing too many people, not being able to work in the office. It was very isolating in a lot of ways. Being broke up with, which is something I mentioned, I want to say like my episode 20 or 19 or something like that. And like this podcast actually, and this platform that I created actually has been something that I've really kept held close to my heart. And it's been like an important thing for me as I've coped during this pandemic, just to keep positive and like continue to share things that are helping other people, and from helping other people that has helped me. So thank you all for listening. If you listen, definitely appreciate this more than you all would ever know. But yeah, I'm doing well. Just glad to be working and enjoying my job and being able to create content which people tend to enjoy for the most part. So hopefully I can just keep on doing that, keep it on bringing value, and innovating as well. So we'll see what else has to come. But I'm doing well. Thank you for asking.
Yeah, you are super innovative. And I think oftentimes our biggest challenges, what comes from that is our biggest growth and innovation and creativity. And like, I think that's an example with the Public Health Millennial. And we'll talk about that more in a little bit, but let's start off to just get to know more about you. How do you identify, and tell us a little bit about your personal background?
Yeah, this is very different beat on the other side of things. That is for sure. But a little bit about myself. I identify he, him pronouns. I wouldn't mind if you call me they, them, she, just don't be disrespectful, but he, him is how I identify. Originally from Trinidad and Tobago, grew up there until I was 16, lived in not a small, pretty big country called the Sultanate of Oman in the Middle East, where I did my last 2 years of high school. Went on and came to the US, got my bachelor's degree and my master's degree, which we'll talk about in a bit. Moved to Alaska, which I never thought was anything that I would ever do in my life, didn't even think about it, but then amazing experience. And right now I am in Winston-Salem, North Carolina. About my personal background, I enjoy sports. My favorite sports teams are football teams, what you go with Americans call soccer teams, Bayern Munich and Arsenal. So it's been a pretty tough couple days of past, but enjoying it. I love to read, love to learn. Heavily passionate, and I feel like just so aligned with health equity and wanting to help people, and content creation is just something that has really came upon me in the last year or so. So that's a lot about my personal background. I like to try new things, vegan-ish. Yeah.
I love the veganish. I love that. And you've lived all sorts of places. And that, I'm sure, informs your perspective, your point of view, your work, all of it. So let's talk a little bit about well, actually, let me backtrack, because this is a really important question you ask everyone. I want to make sure we ask you. what does public health mean to you?
Yeah. And I didn't prepare for this question, as I was telling Marissa before the interview. So if you want a really good answer, go back to episode 1 where I like scripted out something and wrote it. But what I can say, like right now, thinking about public health, it has become an avenue for me to make the change that I think needs to be seen in the world. Um, like growing up, a lot of us in public health want to say we want to help people, and a lot of the ways that we know how to do that in traditional society is being a doctor, being a nurse. And I think public health has been undervalued for so long. And it is like, if public health works well, it works for the most vulnerable communities, the most marginalized communities, to ensure that they not only have their health, but they have all their other needs met, and that they're able to live out their best life. As I've said in my story growing up, I haven't, as I've said, but as you might allude to, I've been very privileged in my life, and I've had a lot of opportunities that a lot of other Black males just would not have had, or just exposure to things that people wouldn't have, and just seeing things. And I think that has been something that I've really reflected on and been very appreciative of. And I just want to be able to have little Black boys and girls who look like me get those same types of exposures and experiences, so that they can live out a life that's full and whole, whatever that means to them. And that starts with public health.
Yeah, I mean, I think what you're speaking to, like everyone who is in public health understands, which is public health is everything, and everything's public health. Like it's much bigger than I think people who are not in the field think, and it impacts every aspect of our life and our whole well-being and our community. And yeah, so I love that answer.
Well, thank you very much.
Well, let's talk a little bit about your undergrad experience. You got a Bachelor's of Science in Biology at the University of Tampa. Can you tell us a little bit about your thought process for this degree and going to University of Tampa?
Yeah. Like as you said that, I didn't think back to this moment, but we had like a senior banquet night or whatever, and it was after all the seniors got accepted into university, or decided that they were going to pursue other career aspirations after they graduated. And I remember just going up and speaking and literally crying in front of everybody, because I was like, I never thought in my mind that I was going to college. Like it wasn't something that I really thought about, even while doing SAT prep, while doing the SATs and all these kinds of things. So it was really amazing for me just to like reflect in that moment and be like, oh, I'm doing this thing that a lot of people like aspire to do, that you see in movies and whatnot. But the thought process there was, I was in Oman still, and it was interesting. There are a lot of schools that come to, a lot of like universities that come to Oman to do like, oh, this is our school, these are our programs and things like that. So applied to University of Tampa, was able to talk to like the representative there. They basically gave me like the biggest scholarship to come, as well as I had family in Gainesville, Florida, which was like 2 hours away from Tampa, where University of Tampa is. So that was the thought process there. Didn't really, like looking back on it, because I went into undergrad as a pre-veterinary major. No shade to the counselor in high school, but he was like, what do you like to do? I was like, I like dogs, I like pets. He's like, oh, you should become a vet. Horrible. Don't take that kind of advice. That's not good advice. But thankfully, despite it not being good advice, I was good at biology, and it led me in this direction to know that, okay, I wanted to help people. And that was like, I switched from pre-vet to pre-med, and then came into public health later on in my master's program. But yeah, we'll get to that as well.
I think that's such a common experience. Actually, I haven't heard the vet part of it as much, but I'm sure there are many others who have come to public health through that. Like a lot of people do that through medicine, and we know that we're interested in helping people. We may like or love science, maybe not, but like that journey, I think so many of your listeners can relate to. I also know you had a few volunteer opportunities that I'm guessing informed kind of your development and your thinking about what you want to do. One of which was as a patient care and pre-op at the Memorial Hospital in Tampa, and the other was at the Malcolm Randall Veterans Hospital. So can you share a little bit about those experiences?
Yeah, during undergrad, I wouldn't say because during my master's program and my undergrad program, I would consider myself two different people. I don't know if that's maturity or whatever the case might be, but I put myself out there for certain opportunities and they just never came my way. And at this point in time, I was like, oh, I'm coming up into my senior year. I need to like get some kind of experience type thing. So it was like, there's a hospital that's like walking distance from where I was living. I applied there, just got an intern there. And that was cool in the sense that I got to work closely with nurses. I got to like interact with patients to understand what was going on. And this was like pre and post ops, people that were doing all kinds of different surgeries. They were like a little woo woo after they come out of this surgery, a little funny and stuff like that. So really good interactions with people. And I think it kind of informed what I didn't realize at the time, but throughout, and I can talk about that more in my second opportunity. But yeah, it informed something that I'll talk about a little bit later on in my journey. But then I graduated, so I moved on from Tampa, moved to Gainesville, Florida, because I graduated in December 2016. It took me 4.5 years to graduate from undergrad, which is normal. I think it's fine. Just so anyone out there might be thinking about that, like you're fine, you're gonna be on a great path. Doesn't matter how long it takes. Once you know you're doing it for the right reasons. Okay, so I graduated in December, was still thinking about going to med school. My grades were not the best. I was thinking, okay, I don't think I want to stress myself to both take the MCAT as well as apply to all the different programs, because that in itself is a task. So I decided to want to apply for Masters of medical sciences programs. And before I was doing that, I was like, okay, let me see if I can get some internship or like volunteer experience. And I was able to work at the VA hospital. And it was extremely different from the hospital in Tampa. One of the main things that I understood in the hospital in Tampa is like, if we're close to someone, you gotta say hi, you gotta like acknowledge them, smile, depending on how far away you are from them. And that was not part of the culture in the VA. So that was one thing that really stood out to me. It's like, oh, you wanna say this is a VA hospital helping the veterans, but you're not even like doing the simplest things that can make the experience so much more rich. And I guess that was a little bit of public health in me. But at the VA hospital, I did a lot of work on the Healthy eVet. So it's like the online portal, and I just try to get people to sign up for the portal. So not really too extensive, just going around talking to people, asking them if they have the service, if they need help with it or anything like that. So that's most of what I did in those two internships, but really showed me what working in a healthcare facility could look like. And it turned out that's not something that I was ideally looking for, per se.
Yeah, I think part of doing those opportunities are to both learn what you like, but also what you don't like or what you don't want to be doing. So I'm glad you brought that up. And I'm you went in thinking vet, and then you switched to pre-med and did some biology and had these volunteer experiences. Looking back at your time in undergrad, what are some of your major takeaways now that you're where you are now in your career looking back?
I would say get involved earlier, get more experience, those kinds of things. I think I went into college trying to get this like American experience, and in doing so, didn't really think about engaging. It didn't even have to be like engaging in something that's very academic. It could have been the Caribbean Student Association. I didn't engage with them until like 2 years into university, and all these different ways that I could have experienced school a little more, as well as gotten like leadership skills and things like that. So I think just putting yourself out there to get those experiences, especially with this podcast, and we're talking to amazing people like yourself and other people, I've just realized how fortunate I am, even though I didn't have a lot of those hardcore experiences in undergrad, that I was fortunate to get the types of positions and things that I've gotten. Because looking at some of the people that I've interviewed, they were like leaps and bounds ahead of me in undergrad and in an experience and things like that. And I think that kind of informed my perspective going into my graduate program as well.
Yeah, I think, what you're speaking to a little bit is you create your own experience as a student, and like, choosing what you engage in and what you do, and I do think sometimes we have this idea of what college is supposed to be like, so we don't take that ownership to decide, like, even out of academia, which you mentioned, which I think is great. But what I also love about your story is, like, even though maybe you weren't as intentional, you learned so much and you allowed yourself to evolve and switch majors and volunteer and learn you didn't want to be at the VA, and you still took it in stride and learned and grew so much, which is also the point, of that journey as well. So I
Absolutely,
love that.
absolutely. And just to put in perspective, what kind of student I was in undergrad, let's say we had an exam tomorrow, the day after, I was someone who would go out and like party and then just stay up for the rest of the night studying for that exam. I'd usually do decently well. That's not something that I recommend to other students out there, though.
No, but I will say, if we went to school together, you would have been someone where I was like, I wish I could do that, because I would be out flat if I did that. So that is a skill too, to be able to do that.
Yeah, I don't think I can do that anymore, but
No.
back then.
Okay, so tell us a little bit about, then you went on to get your master's of public health at the University of Florida. What was that like, the thought process? What was your concentration?
Yeah. So I said I graduated in December 2016. At that point, I still was thinking I wanted to wanted to become a physician. And at that point, I was like, okay, it doesn't really make sense to apply directly to medical school. It makes sense to try to apply for these one-year master programs called Masters of Medical Sciences programs. So I was, during that December to getting into my MPH program in the fall, I was studying for the MCAT, volunteering at the VA, and applied for 4 Masters of Medical Sciences programs. I got accepted into one of them, but it was like very late. So I should say I got rejected from 3 of them, and I was like, oh crap, what am I going to do? So I was in that position when I was in Gainesville. I was like, oh crap, like things aren't going the way that I want them to go. Thinking through that. So I was like, okay, what else can I do out here? And I just looked up like what you can do with a biology degree, found like Masters of Public Health, literally found Masters. I was like, okay, I'm not really too sure what this is, but it's something that aligns, makes sense. Applied to University of Florida's program and George Washington University's program, and I got into both of those. And then after I got into both of those, I got the acceptance from USF that I got into the Masters of Medical Sciences program. It's quite interesting, actually, because one of my good friends from undergrad got into that same program, and he was like, oh, you're going to come? And so that was a tough choice. I was like, do I go to this one-year program where I can only really go into medical school afterwards? Or it's like catered towards going into medical school afterwards. And all I'm thinking in my head is, right now, I'm not doing schoolwork. All I'm doing is studying for this MCAT and volunteering, and I'm stressed. and then there's going to be the added component of studying for the MCAT and then applying for schools. And I was like, even with all that studying and with everything, there's no guarantee that even if I get into the Masters of Medical Sciences program, that when I do apply in the next year, that I'll get into medical school. So I was like, let me just do this MPH. Let me see what this is about. If I still want to become a doctor, I could become a doctor. And my plan was to still become a doctor afterwards. But I decided to get the Masters of Public Health and to pursue it at the University of Florida.
Yeah, I'm sure many people, and this is in my story too, that you've interviewed have similar, where you hit rejection at some point. And I'm not the author of this statement, but I love it. Often rejection is just redirection. And I love that part of your story is like, you were really faced with what to do and you worked to figure it out, and it totally redirected you. So can you share a little bit more about your experience in the Masters of Public Health program and what changed in your thinking and what you studied?
Yeah, I think it's a tragedy, because I'm guessing that it's going to be similar around the country, maybe around the world, that biology students that want to go into medicine don't get training in any kind of public health, any kind of health insurance, anything of the sorts that would really get you to understand what the systems of being a doctor are. And thankfully, as I got into my Masters of Public Health program, I realized just how much disparities or health inequities, we should say, there were in Black and white patients, and just like the thought of, okay, if I become a physician and I'm treating this patient and we're treating them for this thing today, but we really know when they go home, the issue is that they have lead in their house, or they don't have transportation, or don't have good food. I'm not really doing anything here. I'm just treating the problem, and it isn't changing anything. And as like, I'm someone who's very frustrated with where the world is right now, and I didn't want to be in a position where I felt like I was in a system that wasn't changing or wasn't improving lives, but it was really just treating the after effects of it. And at the same point in time, I was thinking, if I go into medical school, I don't think that I would want to practice medicine for the rest of my life. I don't think I would want to be in a hospital or a clinic for the rest of my life. So I was like, is it worth the investment? And at the same point in time, I feel like I was getting old. Not really, but I felt like I was getting old. And I just like, well, public health seems like there's just a systemic way, or like just different ways to approach the issue of health and improving people's lives. And I just like the population factor into it. And I think, as I said earlier, public health is just so undervalued, and I think that's undervalued in salaries compared to medicine. There's so many things that we don't appreciate about public health, yet it helps everyone, and it gives protections to everyone. So that this is a book that's probably going to be written in the next 10 years, so you guys can notice it, but just like the undervaluement of public health, because it's something that really bothers me, like falling into public health and knowing that this is a field that can make so much impact, yet it's just not taken on enough, or it's like only looked at when things are going bad, but and other things like that. So yeah, I don't know, I'm going all over the place now.
No, yeah. I mean, I think obviously there's a place for direct care, whether it's medicine or social work or whatnot. But I think what you're speaking to, so many of us in public health can relate, which is like this light bulb moment where you realize, oh, we can prevent this. Like, this is preventable, and not just with one person, with the community, and that light bulb moment of like, this is the work I want to do. And I think you're right about the undervaluing, and that is a challenge. But what comes out of that challenge is innovation, which is like one thing you're doing with Public Health Millennial. So, and we'll talk more about that. But I'm really curious, like, once you kind of had that switch, did your MPH offer like tracks or concentration? Like, what was the focus of your study?
Yeah, so I actually had to choose my concentration before I started the program, and I decided to get a health management and policy concentration, which I think now is called population health management, which is a lot better of a title in my opinion. And I was one of the people that kind of advocated for the change. But the thought process there was like, in undergrad, I was doing microbiology and looking at like little micro things. I was like, all right, let's go as big as possible. Let's go systems and management. So that was my thought process for choosing it, basically.
You went straight from micro to macro, like
real quick.
The opposite ends of the spectrum.
Yeah, absolutely.
So I also know that during your master's in public health, you were pretty engaged in the community and doing work. Like, one of the things, you were the president of the Public Health Student Association and a committee member for the Public Health Policy Committee at the University of Florida. Can you tell us a little bit about that, how you got involved and what you did?
Yeah, absolutely. So one of the things that I alluded to earlier was that during undergrad and during my master's program, I was two different people. I entered my master's of public health program, and I was like, okay, if I'm not going to become a physician, I'm going to become the best public health professional, I would say, and I'm going to do everything that I can to get to that point. So for me, like, as I entered, it was everything is so new to me. So I was like excited about everything. I was excited to learn and just grasp and just ask questions. One of the main things that I think changed from undergrad to my master's program was like, I try to sit in front for every class. I ask questions all the time. There were no awkward silences in classes because I'm not a person that would try to answer the question or say something. I just took that effort. I just like changed up my mindset and said, okay, let me just get the most out of this, because I want to get the most out of this. I want to make that impact. And even with that change in mindset, I kind of doubted myself, because there was the Public Health Student Association, which is the student association for public health students, masters. It was an association and they were having elections and I wasn't going to run. Thankfully, my ex-girlfriend kind of like pushed me to kind of go run. And I say that to say, like, you should always have somebody that's going to like push you to do the things that you don't think are possible, but they think you are worth it. So having the people in your side of the court are very important. So I went up there. It was very funny in the sense that for the elections itself, everyone else had like written down stuff. They were looking at the resume. Me, I don't write down anything. I didn't practice anything. I just went up there. I was like, I don't really have any leadership experience, but I think this would be good for me. And I think I'd be able to help you all in this way and that way. People voted for me and I became the president. And from then, I think like my trajectory just changed because that was like my first leadership experience that I was able to get. And from being the president of the Public Health Student Association, I became a committee member for the Public Health Policy Committee at the University of Florida. So I sat on like this board as a lone student liaison to the like school to say, okay, here's what the students are thinking. Like, for example, the population health management concentration change. That was something I was at the table being able to say, oh yeah, I think that makes sense. And just being in that room with people who are the dean and like the assistant professors and all these big names, and just being able to know that my voice was heard was kind of cool. And yeah, I really enjoyed that experience of being the president as well as being on that committee. And it really allowed me to elevate my game as a leader. And I think began the start of like me just wanting to continue to lead and to engage with people and do that type of work.
Yeah. And I think you didn't say this, so correct me if I'm wrong, but what I kind of hear coming from you is like, there was a passion in you once you realized what public health is and you understood, health inequities that maybe helped you show up in that way and sit in the front of the class and raise your hand and step into leadership. And I'm just curious, like, what was that like really taking on more leadership and taking more initiative and like driving that?
Scary, tiring, but I knew at the end of the day, like, I'm paying for this schooling. And this is something that I invested in me. So just knowing that 2 years is a short time. It might seem like a long time, but it's a very short time. So I just knew that I had to make the most out of every opportunity, every experience, every interaction that I had during my program. So I just continued to just build on that and just keep that momentum going.
Yeah. And I think there is some scariness about stepping up and stepping into your own, but like, that's a good thing. That sometimes is a sign like you're evolving and you're growing. So I'm glad you mentioned that. So anyone listening, if you have a little fear raising your hand in class or sitting in front or stepping up to say, hey, vote for me as president, even if you don't have a speech, like that's okay. Right?
Yeah, you should prepare a little bit more than I did, but yeah, definitely just do it, because the worst thing that's going to happen is you're going to be in the same position that you were right now. And the thing that prevents a lot of us from doing these kinds of things is ego and the fragility in us, like knowing that we're putting ourselves out there and there is this chance of rejection, but there's always a chance of rejection for anything in life. So just do it. And, the more that you do those small things, the easier it is to take those chances on yourself.
Yeah, definitely. And also like, don't reject yourself by not doing it. Absolutely. Right? Because you're scared other people are going to reject you. So I love that. And I know you also did a couple other things in your program. You were on a community initiatives, your assistant planner at the WellFlorida Council, and then you're at the Rural Health Advocacy and you're a policy intern there. Can you share a little bit about those experiences? It sounds like they were outside the university. How are they different? What'd you do?
Yeah, absolutely. So basically one of my professors was like, yeah, we have internships available. If anyone's interested, just let me know. And I think I was the only student in my concentration. I was like, oh yeah, I need an internship. I'm letting you know. Very informal interview. I was able to work for WellFlorida, which is like a health council that serves, I'm going to get it wrong, I want to say like 15 or something counties in North Florida. So they do a lot of the community engagement work, community health needs assessment work, a lot of data work. And there I was able to really take some of the skills that I built throughout my MPH in a class specifically community-based participatory research. And that mightn't be the specific name of the class, but that's what we learned in the class. And funnily enough, the person that taught that class was actually my preceptor at WellFlorida, which was awesome. So literally the same person that taught me the kind of things was the person that was helping me implement it. So I was able to actually get that practice. I was able to go out into communities and to do focus groups. I was able to work on the Alachua County Community Health Survey, so survey development. I helped out with the high impact prevention program, which was the HIV AIDS awareness. So I would go like to health fairs, give out condoms, talk to people. It's crazy how misinformed people are around like sex and sex norms, but that was interesting in itself. I did some community health improvement plans, and I also used this position as my I can't remember what you specifically call it, but the people that I do my capstone project with. So I don't know if you know the word for that.
Like your site or advisor?
Yes, my site. So that's my site for my capstone. And I was working with the Marion County Opioid Task Force. And from there, I was able to do a Marion County Opioid White Paper, which was really informing the data of the task force, well, the data that was coming up around the opioids or substance misuse in the region, talking about the larger US issue with it, talking about how fentanyl is coming out. This was like when fentanyl was now starting to come out. So it was an interesting time, but I really enjoyed that. And I got to present that at the task force as well as for my capstone, and I passed. So I think that went well. And then the other opportunity was with Suwannee River AHEC, as well as like Florida Rural Health Association. I don't know how they differ or they're the same, but I think they have the same CEO. And funnily enough, that CEO is the partner to the other person that I was looking for at WellFlorida. So interestingly. But I got this position from career speed dating that my MPH program hosted, which was cool because I already had an internship. So I was like, I don't really need anything. And I was just going around. And then one of my friends, Fizza, she was looking for an internship. And then we ended up going in together and did the speed dating interview with Sarah Catalanato. And we were chosen to write this like rural health white paper. And then Fizza got another internship in DC. So it was just me doing this. So that was kind of sucky in the sense that I thought I was going to do half this project, but now I have to do the entire project. And from that, it was really cool because I got to collect data around the difference in rural health and urban health in Florida, and just comparing those. I was able to present at a couple conferences. And one thing, I actually have the paper. It's like one of the things that I have, like public health at work, for anyone that's watching. And one of the things that I did want to mention here was that when I did present at the first conference, my professor, who's also the CEO of WellFlorida, was there. And he realized while I was presenting that I analyzed the data incorrectly. So I'm presenting in front of the conference, maybe like 100 people there, saying everything on my slides ready. And then afterwards, he's like, you messed up the data. So I say this to say, like, especially when you're in your master's program or undergrad program, ask for feedback early on, make sure that you're doing the right thing, because I had to go back and go through all that data. And it was a lot because it was for like a bunch of different social determinants of health. But yeah, that was a learning experience. Always asking for feedback now, making sure I'm doing the right thing. I'm looking at data the right way. So those were those two opportunities, really pivotal, helped me really hone both like the community health needs assessment skill sets that I have and building out surveys, as well as like learning about community engagement and presenting. I think these were like the times that I really, well, from the president of the Public Health Student Association into this, really like just helped me get more comfortable presenting.
Yeah, so it's interesting. It sounds like, so you had your coursework and like thinking about health policy in the macro level, and then you had some leadership experiences, and then you were in the community learning how to do public health in action. With that combination of those three kind of things you were doing, what was your biggest takeaway or the thing you learned looking back?
I think looking back, if I was to do everything again, I would do it exactly the same way. And by that, I mean, I entered my master's of public health program not knowing anything about public health. And then I heard that there was the American Public Health Association conference. I was like, oh, what's that? Oh, 16,000 public health professionals going to be there. I went to that. And that was like an eye-opening experience for myself, just not knowing what public health is, and then going 3 months into the program, and then being able to interact with so many different types of people in public health. That was just amazing to know that, okay, this field is massive. It touches so many things. So I think getting that, and even if you don't attend the APHA conference, networking is, I think, a key thing, especially with Instagram. A lot of public health people coming up on Instagram these days, or just LinkedIn. LinkedIn was a thing that I used so much and really developed a love for during my MPH program, just looking at jobs, looking at skill sets, looking at people's career trajectory. So I think just having that ability to learn and wanting to learn, I think, was my biggest takeaway, and just like actioning on that, kind of being a little obsessive over it.
Yeah. And I would say, I mean, I think we're the same age, or at least at school around the same time. And LinkedIn is way more public health folks are on LinkedIn now than when we were in school. So definitely take advantage. So after you graduated, you got a fellowship. You became a community health fellow at the Matsu Health Foundation in Alaska, Florida to Alaska. Tell us how that happened.
Yeah, funny enough, it was just a Google job alert that I had put on when I started really understanding, oh, fellowships are like a way to kind of leverage the beginning of your career to really accelerate your career. So I was like, okay, let me put on a Google job alert for public health fellowships throughout the entire USA. So I did that. And I should always preface this by saying that I applied for 4 health administration fellowships. I got interviews for a couple of them, and then I was rejected from all 4 of them. But what I learned from these rejections was that, okay, this is a high pressure situation. I need to know these kinds of things about the organization. I need to think about these kinds of things. It just made me more relaxed in that interview environment. So I was going to apply to more health administration fellowships because there's like 2 cycles. I think it ends in November and then one in January or something like that. And during December, I got this email to my Google, my Gmail, that there was a job in Alaska. And at first I was like, oh, okay. And then I looked into it, and it was basically asking for someone who can help with the community health needs assessment, and specifically the photo voice component of it. So it was like a perfect fit, going from like what I had learned and the things like that. So I was just happy that I was able to interview. They liked me. And I was off to Alaska. I was like, never in my life did I even think about Alaska. I didn't even know if I looked at Alaska on a map before going to Alaska. But I was like, if it was supposed to be just a 1-year fellowship with the potential to get hired into a full-time position. So I was like, 1 year in Alaska is not going to be bad. So I went.
It's so cool. I think photo voice is really cool. I'm not sure if everyone listening knows what that is. Can you share a little bit about what that is?
Yeah, absolutely. Photo voice is a really cool community-based participatory research tool. Is that what they call it, a tool? But what it really is it's a way of capturing perspectives on a community issue. And with it, you take like pictures in response to specific prompts that you create as a group, and you discuss them in a group, and you write captions. And from the captions and the pictures, you get themes from that. And it's really cool in the sense that we had a literal presentation, like an art exhibit, where we had a bunch of different, because in total in this project, which I'll probably talk a little bit more about in a bit, we had 263 pictures, like 69 people engaging and taking pictures. So just a really cool way to collect data and understand themes about different situations. And it has its roots, I believe, in like the feminist movement and empowering women, as well as, I think, the LGBTQ plus movement. I could be wrong with the LGBTQ plus, but I know it has some roots in feminist movement.
Yeah, thanks for sharing that. It is such a great tool to engage the community and bring art and perspective into it. And, people learn visually. And I actually think it's not used enough. So I'm so glad you had the opportunity and can share for anyone listening who that might be of interest. Like they could explore that in their master's program or offer that in their job, maybe as an opportunity.
Absolutely, especially with cameras with high quality pictures being so easily accessible. I think it's something that is definitely not used a lot, and I will touch on it a little bit in a bit, but I think it just gets to data that you just can't see in other ways. So it's very important for, especially for, because in the photo voice that we did, we worked with a couple Alaska Native tribes, and there just aren't questions to understand certain parts of their lives. So photo voice is really great way for them to have their voice heard and seen and really understood.
Yeah. So can you tell us more about what you did as a fellow? Like what the community assessment was like, what your day to day, like what were you doing that time when you were in this job?
Yeah, and one thing I wanted to say before we get into like what I did in the job, when I was interviewing for this, they asked us to like come prepared or like know what a photo voice project looked like. So I literally over prepared. So I literally wrote out, okay, I because I thought the interview was gonna be like, okay, walk me through like your project, but it wasn't like that. But I had literally every step, okay, we're gonna do 3 groups, this is how we're gonna engage them, this is how we're gonna do all of this. And this photo voice wasn't something I heard of until I saw this job posting. So it was something that I learned about and I over prepared for. So I just say that to say, like, you never know what's going to come in an interview, but it's better to be over prepared than under prepared.
Omari, I love you're either like, I didn't prepare at all or I super prepared.
It's exactly how it happens, right? Yeah. And I guess to preface the coming in to do the community health needs assessment and the photo voice. So what they really were trying to do is, we all know that community health needs assessments are mandated by the IRS, by I think nonprofit hospitals to do every 3 years. And what the steering committee really wanted was a way to hear not only the traditional or get the traditional data, but have a community-based methodology to hear from the different groups that traditionally aren't captured in that big data sets. Like, I can't even remember the big data sets right now. Sorry, public health evaluation people. Um, and so what I was brought in to do was initially just this, just do the photo voice project, get these groups. So it was really recruitment of groups. So we asked for support through the different groups that we already had in the community to see what groups would be willing to do this. Thankfully, we were able to get the Nick tribe as well as the Chickaloon Traditional Council, which is also a native tribe in Alaska, as well as elder citizens group, youth group. We tried to get the Russian community, because interestingly enough, something that I didn't know, there are a lot of Russians, a lot of Orthodox Russians in Alaska, but
They're so close, Alaska and Russia.
They are. I think from some places you can see it. But yeah, they are a very to themselves kind of people. So I went to a couple of their churches, spoke to them, but they were like, probably not, kind of thing, which is okay, I suppose. And then in that, I'm talking specifically about the community health needs assessment. The 2 prompts that we asked the groups were, what about your life and or community is challenging to your health? And what about your life and or community is supportive to your health? As I said, we got 61 participants, 263 pictures. And one of the things that I thought was like important to mention here for everyone to hear is, it was important to do this because, as I said, the steering committee wanted to hear less traditional, more community-based approaches to getting data. And some of the things that stood out that couldn't be captured in like the big data sets were things like the importance of cultural values and community, racial equity and discrimination, environmental stewardship, affordable family activities, spirituality feeding the soul, and social connection. There just aren't questions that get at these things at a macro scale. Just wanted to highlight that for people that are working in big data, to just know that qualitative data and really hearing from different mixed method use of data is just so important. Okay. But outside of that, when the community health needs assessment was finished, I did a lot of like management of evaluation. So evaluation for a couple different programs. I did survey development. I did a little bit of grant. Well, I wrote my first grant actually, and I got my first $10,000 grant. I think that's the only grant I've written in my life. I was thankful to get that. What else did I do? We worked on there was a youth homeless demonstration project. So I did a lot of needs assessments, so a lot of data stuff. So I was heading a lot of the data stuff, data writing, the evaluation parts, and then supporting work however else possible, as well as doing some grant review. And this is also a time where, because it was a health foundation, and I had no idea what that was until I got there. And I still kind of didn't know what it was as I was working there. But it opened up my eyes to this field, or this tangential field of public health philanthropy in which I work today. So that's just a couple of the things that I worked on. My LinkedIn probably has a lot more details that could be helpful. But yeah.
That's so cool. I mean, that's truly public health in action. And I just want to say, to your point about the data sets, also, like, you got to think about who's writing these macro questions in these surveys. Like, who's creating it influences the questions that get asked. And so that is why it's important to have community-based participatory research, so that their questions get asked and answered.
Absolutely agree with that.
Yeah. So I know you started the Public Health Millennial in that role. We'll talk about that in a little bit, but is there anything else about your time in Alaska or as a community health fellow you want to make sure to share and that folks can know?
Going in a new place, enjoy the things that are different there. I think if you have that opportunity to go somewhere away from where you went to school, where you lived, I think it's just eye-opening, and that's an experience in itself. And just being able to say that I'm from Trinidad, I went to school in Florida, and then I worked in Alaska, that does a lot for me. And it's like a huge part of my story, and I would say a huge part of the narrative that I told that was helpful in me getting the job that I have today.
Yeah. And so let's talk a little bit about the role you're in now, and we'll come back to talk about the Public Health Millennial, because this is your 100th episode. So we want to make sure we talk about that. But right now, you're a health improvement program officer at the Kate B. Reynolds Charitable Trust. How did you go from being a fellow to being in this role? How did you get it? And what do you do? Tell us a little bit about that.
Yeah. So as I said, it was a 1-year fellowship with the potential to get hired into a full-time position. I was actually going to get hired into a full-time position. They literally showed me like my job description and everything like that. But then the pandemic hit. My supervisor at the time shifted out and started her own consulting company. So my position just wasn't of like high importance at the time. So what they did was extended my fellowship 3 more months. And from then I was like searching for jobs. So I was applying like crazy. And one thing that stood out to me when I was in Alaska was, okay, there are these people that work as program officers, and they work in a kind of like systems oriented way to make health change on like a large scale. I was like, this is really cool. This is not something I ever heard about. So I found all the different philanthropy boards, like job boards, and there was one that would take you where you can go on all the grant making organizations in a state. And I literally would sit there for like hours going through different organizations to see who had jobs. I would turn on job alerts, and it was just a lot of that type of work, and a lot of rejection, to be honest, a lot of rejection, or a lot of just not hearing back from people. And thankfully, I was able to get an interview with the Kate Reynolds Charitable Trust. Very weird first interview, because it was a one-way interview. I don't know if you all have ever done a one-way interview. That's when you'll kind of like talk into the camera and there's no one else there. Very
like
interesting.
You were auditioning. It was like an audition tape.
Basically, it was an audition. It was an audition tape. I didn't think I did as well as I would have thought, but they thought differently. I got advanced into further interviews, and I was able to get the position as a program officer. And one thing that I should say is, even though I was the public health millennial at this time, even though I'm like advocating for people to do a lot of things, when I was applying for the job, I didn't tell, when I got the interview, I didn't tell people at my current organization. But then it came up somehow, And then the CEO in Alaska was actually on the same board as the CEO in Winston-Salem, North Carolina. So if I didn't say that, I don't know if that situation didn't come up, I don't know if I would be in this position today. But I say that to say, don't be like me. Tell everyone that you're interviewing, that you have this interview. You never know who they might know. Because I know Elizabeth, who is the CEO of the Maxwell Foundation, called Dr. Gerald, who is the CEO in the Cape Reynolds Charitable Trust, and they had a conversation, and that was something that I think also helped me, along with everything else that I brought to the table during the interview. But just saying that, you have to put it out there that you're looking for opportunities and that you're doing these interviews, because then no one can help you if you don't say that it's happening, kind of thing.
Yeah, I think, and so much of your story is about how people connecting people and like how your network has helped you. And I think everyone can relate to that. And networking isn't just a cold email or an awkward, event. Like it is just sharing what's going on with you and with the people around you and reaching out. So I'm glad that happened. And you know what? Like, I think there's this notion that to be a program officer, especially in a like foundation, that you have to be towards the end of your career. Like you have to have so much experience coming into that. And I know I was really interested in that line of work and I had that notion. And so like, can you talk a little bit about that? Is that a myth, misconception? Like, tell me more.
And that's another reason I'm very, very surprised that I'm in this role, because I thought it would be a position that I would get in the next, at that point in time, next 3 years or so. Just because the job was asking for 5 years work experience, and I literally just came out of my MPH. I was 1 year out of my MPH and I was applying for this job. And I think that goes to speak to the value of a fellowship as well, because it just really helps accelerate and you got to do so many different things. But it's a tough field to get into, because there are just not many positions. Like in our organization, or my organization, there are 4 program officers. And those jobs, people typically don't leave those jobs very often. So it is a tough field to break into. I think it is a lot more difficult when you're younger, but I think having those connections and having experiences that help you speak to those types of things, as well as I think health philanthropy is in a place where things are changing for the better. And I think there's a lot of value in Masters of Public Health and the skill sets that people have in Masters of Public Health to really do this type of work that philanthropies and health philanthropies do.
Yeah. So for those listening who maybe don't even know what that looks like, can you tell us what you do? Like, what's your job on the day-to-day and what's your focus and what is being a program officer even like?
Yeah, it's a very hard job to explain. It's very relational. I am the external face for the trust. And let me just backtrack to give you like an overview of the trust. So the Cape Reynolds Charitable Trust, it's a private health foundation, 75 years old this year. We are working towards thriving residents, thriving communities, equitable access to care, and equitable health outcomes. We further Mrs. Kate's mission of working to improve health and quality of life for low-income residents in Forsyth County and around the state of North Carolina. What we do at the Trust is we invest in impact to create equitable systems change, and with an emphasis on focusing on and including underinvested and historically marginalized groups into all conversations to ensure that we are getting that equitable systems change that we are aiming to do. And sorry, what was the specific question?
Well, what does a program officer do? Like, so you set the stage of what the organization does, but what do you do to advance that mission?
Yeah, okay. Still a very hard question for me to answer, but I lead a lot of the strategic work. So thankfully, the team over the last couple of years has done a lot of the hard work to really build out the strategy that we are implementing to this day. So me specifically in my work, I work in the Northeast North Carolina. So my counties are Nash, Edgecombe, and Halifax counties, although it's more of a regional approach that we're doing, and I have a lot of regional connections in the Northeast. And our strategic areas of focus are obesity reduction, which is actually like food systems and active recreation, substance misuses, and ACEs. And I also lead our work stream around grassroots capacity building, which is a lot of how we do our work. So what I do as a program officer is very relational, is very day to day could look very differently. I could be in different convenings, whether that's a food systems partner convening. I could be on phone calls with other health foundations to talk about different ways that we're going to collaborate. I can, like, typically we'd be out in community, we'd be going to meet the community. And one thing that I should have said about trust, and one of the things I really like about working here is, and one of the things that stood out to me when I was looking for jobs, is that one of the key tenets of the trust is that they start by listening to community. So that is like, oh, that's public health. And so I was like, that is exactly what I want. So we literally go out, and around those different strategic focus areas that I mentioned before, we go out and listen to community to hear what their issues are, and to see how we can give them the capital to do that work. So that could be social, moral, intellectual, reputational, or financial capital to do that work. And it looks a lot, it looks different in a lot of ways, but it's a lot of just meetings, to meet with people, to see the types of work they're doing, to connect them to other groups, to make sure that groups are creating strategic plans and they're mapping out things, and they really have the buy-in from the community members to ensure that these projects are being held accountable. For example, another example is, we have a lot of bigger institutions that try to come to us for investments, and they would say that, okay, this is what the community needs. But a lot of the times when we go back to the community and ask them, is this what we need? They'd be like, oh, no, this is not what we need. So ensuring that whenever those types of things are happening, because we have that capital to say, no, you need to include the community. And we have that type of influence and power to do that, to make sure that we are giving our power and resources to the community, so that they can be at the table, and that they can ensure that we're not having the same issues that we're dealing with today in the next 5 years. Because as we know, systems are set up to operate and give the results that they're set up to give. So we need to be very intentional. So that's what we do. We are very bottom up, looking for grassroots groups that are doing this work, that are really pushing the bounds, not really so much on programmatic work, but thinking, okay, we know that we're dealing with this problem here, but how are we dealing with this problem, but also advocating for whether that's a policy change or a systems change to really ensure that we don't have to deal with this problem in a bit. So it's a lot of strategic thinking, a lot of forethinking, a lot of connections, a lot of meetings. We do I don't know. I feel like I'm going all over
The
place.
word that came to mind as you're talking is, it sounds to me like you're all kind of like stewards of the work. Like, you make sure the money is used equitably and with care, and you make sure the community is listened to, and you like are stewarding the work in a way that is grounded and really for the community. And I love that.
Yeah, that is a great word. And yeah, we are stewards of the funds, trying to do our best with the mission and vision that Ms. Keith left. And I think we're doing a great job, and I think we've established a great team to continue to push this work forward. And it's tough in the sense that it's a lot of different focus areas or strategic areas of focus, but it's fun in the sense that it's a lot of different areas of focus. So it's not monotonous. And we definitely connect with a lot of people. And one thing that's very interesting is, though we have like strategic focus areas, groups might think of themselves as intersecting all of those areas and doing that type of work. So it's interesting, the perspective that we put as well as what the community put, and we lean heavy on the community for a lot of the things that we do.
Yeah. So I would love if you could share, like, working at a charitable foundation, being a program officer, what is like the biggest opportunity being in that setting, and what is the biggest challenge?
Biggest opportunity, I think, is having the flexibility to kind of be out of the work. So not have to worry about the day-to-day, but look at it strategically. We've invested money into mapping and then into planning, saying, okay, are things going the way? What are the groups that are operating here? Are there gaps? How can we fill that? And really having that mindset to guide people to say, okay, you're doing this good, but what about this little space here? And having that ability, just think on that systems level is humongous opportunity. Didn't think this was like a role that was possible in life, but I'm grateful to be able to do it. And one thing that I just learned so much from both my internal partners and all the community partners that we have, because it's a lot of relationship and a lot of conversations that go on.
And so what's the biggest challenge on the flip side of that?
Well, specific to my situation, coming from Alaska to North Carolina, new states, not knowing people, not having connections. One thing that I always say, public health changes depending on which state you go to. So that is a huge challenge. Also, starting work during the pandemic has been a challenge because this work is very relational, and then all the relationships that I've created over the last year and almost a half have been over Zoom or Microsoft Teams. So not being able to go into community to be talking about these areas, but not really knowing what it looks like, not really knowing all these things has been a challenge. As well as like just generally, I think as a program officer, it's a challenge in the sense that a lot of us might be thinking about our work, but systems level work takes time, and being able to know that it's going to take the time of trust as well as the amount of time to actually put the actions in to get this work, especially when you're convening different people around a certain issue area. There's going to be those different battles that you have to face, where you have to know that this is all building trust and building towards that change that we need, and that like more capacity in the networks of the community to hold systems accountable and to really shift things from where they are right now.
Yeah, definitely. I mean, I think a lot about how part of the reason we're in the place we are is because over the past, however long, people didn't want to take time to include all communities in creating systems and structures that work for everyone. And so of course it's going to take time to like do something new and undo those systems and start all over, or whatever it is, whatever the approach is. And, in America, we want a quick fix. Like we got to be patient in public health.
Yeah, absolutely. And that just like made me think about a conversation I was having the other day. We're connecting a community group with a bigger institution to do some research work. And they had hesitancies around working with this institution. Like, how are they going to use our data? How are we going to benefit from that? And I was like, to be honest, like I'm not going to stand here and say that I completely trust them, but what I can tell you is that I'm going to have your back if you think anything is going wrong here, to really back you up and tell them that's not how they can treat you. And really, because these institutions are going to be here, so we really have to form and make sure that they are able to work with community partners in equitable ways. And I think just being in this position gives me that leverage to be able to have those conversations and to have people more easily listen to me than would in other circumstances.
Yeah, I think that is the appeal of like the private sector or foundations is the ability to do things differently. And we could have a whole other podcast episode on the frustrations of institutions and how things have been run in certain areas and all that. But that's a discussion for another day.
Absolutely.
Before we talk about the Public Health Millennial, is there anything else you want to share about your current role and your experience in the position you're in now?
Yeah. One thing that stood out to me, and something that I didn't think about, so communication is the thing that stood out to me, both in the sense that we use communication as a strategy to further our work. And I think that wasn't the case, or at least not so much the case in the last foundation that I worked for. And I think that in itself is huge. That is huge, because communication and how we say things and narratives that are out there are just so important. And the other takeaway is also on the communication side. We have the ability to get communications training, which is not something that I really thought about as a thing, but that's something that I hugely leverage. All of you know that I have a podcast, so like I'm always talking and stuff like that. So getting that communications training and learning like these different nuances and things that I just didn't know is very helpful. So I lean on that a lot. I lean on that. And I think everyone who has access to different types of resources like this should lean on it, because you never know when you're going to leave or whatever the case might be.
Listen, I think everyone in an MPH program should have to learn about communications and even marketing. I would go that far. Like we're way underskilled in that department, but it is super necessary.
Absolutely. Yes. Especially, I think the marketing part especially as well.
Yeah. So let's talk about Public Health Millennial. You started this when you were in Alaska. You talked a little bit, but like what prompted you to start it? What was your thought process and what was it like starting this?
Yeah, so as I said, public health was new to me into my master's of public health program. Everything I knew from there until starting the Public Health Millennial was just learning. And after I graduated, I just felt like I had a lot of questions that I wish were answered earlier. I think that my path could have been a lot easier if I just had people that can answer my questions. And not to throw shade on any of the academics or any of the professors or anything like that, but a lot of the times I would go to them and try to have conversations, and they are more academic focused when I was more practitioner focused. I didn't really have a lot of that support. So I just wanted to be that person that found out about public health. I was like, oh, this is a really cool field. Like, why didn't I know about this during my undergrad? So I was like, let me just do this. What it was like in the beginning, Alaska, if you all don't know, it's like 4 hours behind most people. So people were asleep. I had extra time, and I would spend a lot, because if you see my website right now, to this day, everything on my website I built myself. So I like hand built that. So it was a lot of late nights being on YouTube on my computer, figuring out how to build a website, how to create a blog, and just doing that kind of work. And I should say, like, I guess from creating the website and creating the blog, it was like, oh crap, no one's gonna search for the PH Millennial. That's so random. so I created the Instagram account to kind of go along with the blog, and that's where things started.
Yeah, I agree with you. I struggled in my master's program because all the faculty are researchers, and that's a whole structure systems issue too. But I think you're right. And so when you started this, it sounds like you're like, okay, I want to fill the gap where I wish I had someone telling me what they do. And so was the podcast the idea in the beginning to interview people, or what was like the initial idea? What was your kind of thought process to get this off the ground?
For the podcast specifically?
Yeah.
Yeah, so the podcast is interesting. This is also stood up when the pandemic hit, my relationship ended type thing, and I realized that I wouldn't have a full-time position in Alaska anymore. So I was just having a lot of informational interviews with a bunch of people using LinkedIn as a resource. And then I think during the pandemic, like when the pandemic just hit, is when I started to get into podcast. I was like, oh, this is kind of cool. I was like, I wonder if anyone's doing this with public health. I searched up, there was Dr. Huntley, who still has a podcast, and there might have been a couple others. I was like, I can do this better than them. So I just literally kind of just transformed my informational interviews into a more structured podcast, and then started from there.
Yeah, so it sounds like, correct me if I'm wrong, it's not like you had this master plan and everything. It was like step by step. You're like, oh, let me do this. Let me try this. Let me do this. And then it like unfolded this way.
Absolutely. It has been a game of trial and error. And thankfully, a lot of things that I tried have worked, or have worked somewhat. But yeah, it wasn't something that I was like, okay, I'm going to create this platform, and it's going to have a website, a blog, a YouTube channel, a podcast. It was like, okay, I just need to share information. Let me create a blog. That's what people do. And I was like, okay, no one's going to be able to find this blog anyway. So let me create this Instagram. And then from that, I was like, I'm going to create a community side of it. That's when I created the LinkedIn group, which isn't very active. But if you want to be active with the public health community, join the Discord group. That is the phmillennial.com/join. That is the phmillennial.com/join. That's where you can find me, Marissa, and all the cool people in public health. Yeah.
And I'm sure you'll put a link in the show notes too.
Absolutely.
But I think that's so important, because I think when you're doing something innovative, like it's not always like, the how, but I'm guessing your mission drove you to figure out the how.
Absolutely. A lot of long nights figuring out what would be best. Like, even like looking back on it now, I wish that I started like a Discord group, or like a group that had more chat-like functions, as opposed to having the LinkedIn group, because LinkedIn group isn't as engaging, or it doesn't have that proximity for people. I don't know, people just don't really engage in a LinkedIn group as much as they could have in a Discord group. So like, to my point, that could be a failure in one aspect. But you try something that you're trying to accomplish something, and you go from there as you best know.
Yeah. So how long has it been since you started the Public Health Millennial?
So I started the the blog in July or August of 2019. And then I started the podcast in May of 2020.
Okay. So since the beginning, it's been 3 years.
Yeah, wow. I didn't even think about that.
Looking back, like what are some of your lessons you learned through going through this experience of starting this network and this, podcast and the Discord and everything?
Lessons. One of the biggest things that stands out to me, because when I started on Instagram, there weren't many public health people out there. And to this day, there are a lot more. But I know a lot of people that started profiles and stopped. I don't know what the case might be for stopping, whether that's they got busy in their life, whether the page wasn't accomplishing what they wanted it to accomplish, whatever the case might be. But I think like to that point is this something that you want to do for the long term? And it doesn't have to be, but I was consistent throughout those 3 years, going from one type of content to the next and evolving along that path. If you go back to my Instagram account, you can look at my first post. Horrible. I don't know who liked that, but somebody liked it, and it kept me going. And so I think to that point, like knowing what you want out of things and not being dissuaded by outside perspectives, because there are many points when I wanted to quit the Public Health Millennial because I thought that no one cared. I was putting in all this time and effort, and I still feel this way sometimes. And this is even when I have like coworkers messaging me and saying, "Oh, I know the guest that you had in your podcast. Your podcast is doing amazing." And I'm still like, sometimes I feel so down. But just knowing that even though I go through these ups and downs, that creating content has brought me joy and it helps people, and that brings me joy. And knowing that I just want to make a bigger impact is something that I think I've learned, like knowing what your why is and sticking to that and being consistent. Another thing I learned, I think it's good to build out things from the ground up, like such as my website. Generally speaking, I wish that I had someone to do all the things for me now. But I think it's good to learn those basics so that you know when people are like kind of shortchanging you, or because you want to know, you don't know what you don't know until you know it. And I think experiencing and getting most of those things are important. And another thing is just be comfortable being uncomfortable. I think is very important. Like I wasn't someone who I'd say would be on camera or talk a lot. Now I have 100 podcast episodes. I'm not like scared to post a video on LinkedIn or on Instagram or make a reel or do something funny. And I think just be yourself, and do that. And I think that as well, you can copy other people, but bring some kind of unique attributes to it, because I think that's what people like about me, is that I'm myself. I kind of tell it as it is for most of the time. So yeah, those are a couple of the lessons.
Yeah, I was dying laughing when you're talking about your first post being terrible, because as an entrepreneur, I can relate. And I think we let perfection get in the way of just taking action. And you are supposed to evolve. Like the stuff you do in the beginning is not supposed to be as good as 3 years down the road. That's how you get 3 years down the road. And I think the moments where you're like, this is too much, I want to quit, are totally natural. But as you said, your why keeps you going.
Yeah, absolutely. And I think like to that point of perfection is like the death of a lot of things. And we shouldn't focus on perfection, because even if we look at anything let's look at Instagram. You might be thinking, oh, there's a better way to have Instagram, but you're still using it because it's good enough. And I think like just have that good enough and make sure that, because good enough gets us a lot further than continually striving for perfection when there's no such thing as perfection. So yeah.
And you get to decide what good enough is, to your point. Like, don't worry as much about other people, which, it's human nature to care. So like you do have to kind of check that, but you're totally right. Yeah. So given this is the 100th episode, I'm so curious, thinking back to 100 episodes, just specific to the podcast, any reflections you want to share about the podcast journey?
Ooh. Any reflections? Yes.
That was an impromptu question that was not on the sheet. So
I enjoy the podcast. This is really tough. I think for me, it's just something that I've grown into enjoying. Not so much the editing part. Thank you, Laura. I know you're gonna listen to this. Thank you for editing and doing all that for me. But I've appreciated just how diverse public health is, just how willing people are to tell their story, just how underappreciated public health is, and just that we need to have more focus on public health and really get it out there in ways that we want to get it out there, and really controlling that narrative. The podcast has been a joy. I've gotten to meet people from all over the world and share their stories with you all, which has helped me a lot. So I've gotten a lot of laughs. I don't know how to answer this question. I don't know if that was a answer.
That was a great answer. I'm sorry, I totally stumped you and put you on the spot.
No worries. It happens.
But yeah, I mean, like, what you were craving is someone to share with you what public health is and what your career could look like. And now you're serving that to others and bringing that and doing it in community and bringing people together and showing the beauty, the diversity of thought and approaches and experiences. And that's what I heard you say in that reflection.
Yeah, thank you.
Yeah.
And I also like to say, like, you never know who's looking, you never know who's listening, you never know who's seeing. So just putting it out there and putting it into the universe, I think is just so important. And just taking that step, as you said, like, good enough is good enough, and knowing that good enough is good enough, and just putting it out there, I think is a big step that we need to take.
Yeah. Is there anything else on the 100th episode on the podcast you want to share?
Well, some of you may or may not know, I kind of made like a introduction to the network that I started with the Public Health Millennial Network, which currently is podcasters. I'm hoping to have a couple other creators out there on that as well. So that is something new, really trying to hone in on building out more community-based ways for people to understand public health and supporting other podcasters out there. I have made it to 100 episodes. That's a lot of episodes and a lot of learning that I think I could help other people in public health with. Join the Discord group, thephmillennial.com/join. If you're interested in just conversing with us. I'm excited because I'm a very visionary person, and there's so many things that I want to do with the Public Health Millennial, but it's just choosing which ones to do. And I will slowly be launching different things and testing out different things as time goes on. So I'm excited to continue to give you all value. And as always, feel free to reach out if you have any questions or anything like that.
Yeah. So as a visionary, the last question before the Furious Fast Five, which I'm so excited to ask you, where do you see yourself in the future?
Yeah. So I'll answer this, I guess, both career-wise and then public health millennial-wise. Career-wise, sorry, Dr. Gerald and everyone at the trust. I can see myself in this position the next, I can see myself 3 years, and 3 years here. And that's caveated that I really love the team. I really love the work that I do. And if everything continues to line up in that way, and there aren't other opportunities that I think would create bigger impacts, I can see myself staying here because I really do enjoy this work. And once I'm continually learning, but outside of that, I think it's really tough for me to say. I know some people have told me that I'll be like a CEO of a health philanthropy, but I don't know if I want all that responsibility, but we'll see. I just want to make impact and change lives. And I don't even have to be the person that you know who changes lives. We're just doing that work in the background to as I said earlier, to give people the opportunities that I had that a lot of people just don't have, especially a lot of people that look like myself don't have, is something that I'd like to do. In what capacity, I am not too sure. Maybe it's like the Public Health Millennial full-time, so transitioning onto that. I would love the Public Health Millennial to be the #1 media platform where you get all your public health knowledge. So not just this podcast and a blog, but a whole media platform that is really there to support and help public health professionals. I would like to write a book. I've been trying to write this book for like a year or something. I'm gonna finish it this year. You all are gonna see the book soon. And just continuing to grow and learn and have fun and enjoy life with the Public Health Millennial. But I think there's a lot of opportunities if I don't have a full-time job to do a lot of other fun things with the Public Health Millennial. But I think one thing that I'm eyeing at is the professional development realm of massive public health programs. I think they're lacking in a lot of senses. And I know that you and I have had a conversation around these types of things before. So that might be something. Also, people have told me that media agency would be something that's cool. But I don't know. I'm looking for other people that are trying to do cool stuff like this. I want to collaborate. I want to help build out stuff. And also I'm also actually looking for writers. If you want to write public health related content or anything like that, feel free to email me, thephmillennial@gmail.com, or DM me or something, and we can talk more about that. But yeah, there's so much possibilities, I think, that are out there. I don't want to limit myself, but I just know that I want to be impactful in all positions, both my day job and with the Public Health Millennial, whether that is just the Public Health Millennial, which is not like just, but you know what I mean? So just being impactful and trying to continue to help people and hopefully leave a better world after I leave.
Yeah, again, back to you're so grounded in your mission and your why, and that's what drives you. And when you have that, you don't necessarily need the perfect how, like you see all the opportunities in the vision. And so I guess everyone, what you have to do is tune in for episode 300 to find out where Omari is at that point.
Absolutely. So be sure to subscribe. And to that point, yes, I don't think knowing the how is that important, because I didn't know anything about the MPH program. I didn't know anything about the position I'm in. I didn't know anything about fellowships. I didn't know anything about community-based participatory research. And those are all hows that you would have no idea how to get to, but just knowing that, okay, I want to help people. This is a way that I can help people, and going down that path and letting everything take you, I think, is important.
Yes, well said. Okay, let's go into the Furious Five. I feel like need like a drum roll or need like bum, bum, bum. All right. These are questions for anyone who's maybe a new listener. These Furious Five, Omari asked all his guests, so I'm going to ask him. He can't get out of the hot seat. The first one, what advice would you give to a student trying to pursue a career in public health?
Yeah, so I'm going to split this up into two different parts. So this is a student who doesn't know anything about public health, is just entering or just learning about public health. I think that type of student needs to ensure that they're engaging in all types of activities that they can learn from, that they can gain experience and insight into what they really want to do after their career. Because public health, as we know, is a vast field. There's so many ways that you can engage and be impactful and do good work in public health. So really understanding, maybe even looking at your passions. I don't like to be someone who says like follow your passions, because I think that leads people down a path of like not being as happy as they could be, or I don't know. That's a whole different conversation. Sorry for going down that will more follow your passion if you want to. We can talk about that later. But yeah, just ensuring that you're getting all the different knowledge bases to know, okay, this is what I like, this is what I don't like, this is what I can try more of to see if it's what I like. And just having those conversations. LinkedIn is crazy good for meeting people, for reaching out to people, for having conversations, informational interviews, and just learning people's career trajectory. And then the advice for people that are in public health and already know what they kind of want to do. Look, if you know what you want to do, look at the job titles or job postings that are related to those types of jobs that you want to, and see what types of skill sets they're looking for, types of experiences they're looking for, and really try to proactively build in those types of experiences and skill sets that you can talk to it in the interview, that you can master it or like get more experience in it, to just be ahead of the game. And yeah, to them too, I think they should also be expansive and continue to learn and try new opportunities, because public health is vast, and the only way that you're going to know where you want to go is by actually trying it out and then seeing, okay, this is what I want to do.
Yes. Okay. On to the next one. If you were talking to someone wanting to get in your position, what advice would you give them?
This is a very tough question. I would say if you are interested, specifically if you're in like North Carolina, I guess if you're around the nation as well, I would say reach out to me and reach out to other program officers because they are going to be the gateway to really help you understand the field. I was able to help a student at UNC recently with an interview for a health foundation for an internship, summer internship, and just being able to talk to him about like philanthropy speak was very important. And me having that experience in the community health fellowship position to learn more about how philanthropy speak and talking about systems change and that type of work, I think is important. So knowing the language is important, but it's a really hard field to get into, but turn on those job alerts. And I think that there's just so much opportunity for people with masters of public health in the health philanthropy world, health foundation world, because they have the skill sets that are really necessary to bring about the change and do the work that I think a lot of foundations have not done in their past. So really trying to know that and build out those skill sets, and it's tough, but yeah, just seeking out those opportunities to meet people and seeing how you can get involved and get those experiences to really be competitive for these types of positions, because they don't come up very often, but when they do, you got to get it, and people who have connections are more likely to get it. So just continue to build those connections and continue to build your skills, and you'll get there eventually. But reach out to me if you have any questions.
Yes, awesome. So what right now is something you're working on improving in your life?
Yeah, I actually went over like quarterly goals. Me and my partner went over quarterly goals. And I did have a question to the listeners as I'm saying this. Like, one of my goals this year was to watch one movie a month, and I watched like 1.5 episodes of Bridgerton, which I counted as my movie. I don't I don't know if that's my movie or not, but something that I'm trying to improve on is just, and I don't want to say balance because I don't think it's balance, but just having time for me to disconnect, because I'm very good. I do very good at disconnecting from like work, because they have set these boundaries like after 5 p.m. You don't really have to answer emails for the most part and stuff like that. But then right after work, I'm putting down one laptop, opening up the next laptop and getting into Public Health Millennial stuff. And I've become a little obsessive. So just like having time for myself, to decompress in some circumstances, really just trying to build out fundamental habits like waking up early, having a morning routine, working out, or just being active, reading, building out relationships as well as like, yeah, because there's a lot that I think is going on in my life right now, but I think I'm at a great place compared to where I was in the past. And I'm enjoying, and that's the thing about like saying balance, because I enjoy creating content. I enjoy creating podcasts and doing all this work, but it is work sometimes. But so sometimes it's great, sometimes it's not. So just being able to more disconnect with the Public Health Millennial or just those other things, I think is something that I am working on improving right now.
I love how you're improving is like more downtime to watch TV. And mine is, you watched an hour and a half of Bridgerton. I've watched the whole show front and back like 3 times already.
It's really sad because my perspective, because when the pandemic hit, my perspective on a lot of things changed, because during that time, it was the same point in time when my ex-girlfriend broke up with me. And a lot of those things just reminded me of her. So like, funnily enough, even on my drive down from Alaska to North Carolina, hardly listen to any music. It's only like very recently that I started back listening to music because it would just remind me of her. And these are like traumatic things that I'm getting over now. But yeah, I didn't watch any movies, any TV or anything, because it just reminded me of her. And I doubled down on the podcast, doubled down on Public Health Millennial. So I think just realizing that, I don't know if there was like a trauma response that got me into this mindset. So I'm going through all those kind of reflections to really figure out what's going on. Why can't I watch TV shows and like feel okay, kind of thing? Because even if I get a show, I'm like, I got to do something on the side. So it's like trying to disconnect.
Well, I will say, I think people have the opposite problem where they are too much on that, and then they don't have opportunity to think and be creative. So, we all got our things we're trying to work out to quote unquote balance. So,
Yeah.
So professionally, right now, do you recommend anything to the listeners? A book, a podcast, a YouTube?
Yeah, absolutely. First book, well, the only book I'm going to recommend today is 101 Careers in Public Health by Beth Seltzer and Heather Crosner. Featured in that book. Shout out to me. Thank you. Thank you, Heather. But I think it's a great book, especially no matter where you are in your public health journey, especially as a student. I think it's very helpful in really grounding you in different careers that can happen in public health, giving you like salary information and different things like that, as well as actually giving you people and their stories kind of vibe, which I think is great. Join the Discord group, thephmillennial.com/Discord, or you can just check in the description below. I'm really trying to take that to the next level and have a community there and really just forward that for public health to be a place where public health students, professionals could come connect, could learn, could also disconnect, because I think as we've learned during the pandemic, public health people are overworked, burnt out, as they will hear on your podcast. It's important for us to disconnect and find those other ways to reconnect outside of work. So I'm just really trying to create both that platform where it's like educational and helpful to the student, as well as a community where you can do things that are outside of that professional development type of realm. And the last thing that I recommend is definitely Marissa's relaunched podcast, Redefining Rest podcast for public health professionals. It is on the network. It's a great podcast, and I think more timely than ever. So definitely check that out. And I guess small mentions for the other people on the Public Health Millennial Network. We have Tea with Tanya podcast. So listen to that. That's with Tanya Ambrose, as well as the Healthcare Hustle with Winston Wellington Wright. So be sure to check that out if you're interested in like healthcare, health administration type roles. But those three podcasts, as well as this, that's a great combination right there.
Yeah, I love the network, and I think we do. I'm so glad you're highlighting different public health podcasts. And I want to say Omari and I are doing a bit of a collab. So on my podcast, Redefining Rest, I'm having a giveaway. And you can enter to win one of his Health Equity Matters sweatshirts. I think you're wearing the shirt, but we're going to give away the sweatshirt. Yeah. So if you want one, enter the giveaway. You could win. You could also win a $150 local spa gift card, or books, the Burnout book or a Rest book. They're both evidence-based, really good. So I'm sure we'll leave a link in the show notes. So you can head on over and enter and get an awesome Health Equity Matters sweatshirt. What I've been thinking about is like wearing your values on your apparel to let everyone know, yo, these are my values. This is what I'm about. And promoting that, I think, is super valuable. So I'm excited to be able to share that with folks.
Absolutely. Yeah, definitely sign up for the giveaway. Like there's no loss in that at all.
Yeah. So we know folks can connect on the Discord. We're both on there. Definitely check it out. Where else can folks get connected with you?
Ooh, I didn't even think about this. Instagram, of course, that's like the main channel, at the PH Millennial. You can connect with me on LinkedIn. I have a LinkedIn group, the Public Health Millennials. I probably wouldn't try to connect there because I haven't checked that out in a couple weeks. But YouTube, be sure to subscribe on YouTube. I think it's the Public Health Millennial. I think those are the main ways to connect. And you can also join my mailing list. I think it's the phmillennial.com/sign up, and you can join there to get my newsletter. Is underrated, I should say that. So hop onto the newsletter and get those email blasts when they do come out.
Awesome. Well, I think we're at a wrap. I mean, of course, everyone, if you're not already subscribed, do that. Review, like, share. But anything else, Omari, you want to share?
No, I just want to say thank you all for listening and rocking with me and going through all the ebbs and flows of life over the last 3 years. It's been amazing just starting this up and seeing the response, and I'm just glad that I'm able to give value and continue to share great stories with you all. So make sure to subscribe, and look forward to sharing more value in more ways with you all going forward.
Yeah, and I'm sure I can speak on behalf of every listener. Thank you for creating a platform where students, people who aren't students, professionals, like everyone can get a better understanding of what's possible in public health for their career, but but also in the world, in our communities, what they could look like, and just creating a space. Like, you saw a gap and you're filling it. And I'm sure every listener echoes me. Thank you. Amazing work. We're super excited. I can't wait for episode 300 to hear about your multimedia mega empire, Public Health Millennial.
Yeah, absolutely. So be sure to subscribe so you don't miss that one, everyone.